Alright, this is my Introduced Center of Blandford. This is for COM181. This is the informative speech. I am doing mine over autism. Autism is a very individualized disease. It differs from person to person, has several different characteristics and levels, that affect a lot of people who live with it, and the families that live around it, obviously. I would like to, obviously inform about autism spectrum disorder, or I'm just going to call it autism, quick, easy, to the point. Alright, today we will explore the core characteristics of autism spectrum disorder, treatments available for it, and the levels of support involved with living with it and living around it. I actually have autism, so that's why I'm always so jittery in my videos. Okay, so almost everyone does know about autism or about it, but we're going to get a little bit more specific about it today. So let's take a closer look at the core characteristics of autism spectrum disorder. So this is according to About Autism Spectrum Disorder from the CDC as of 2026. Alright, let's take a closer look of it. People with autism spectrum disorder may interact differently with or than others around them, which, deal with inability to concentrate, inability to hold conversations, anything like that. This is also from About Autism Spectrum Disorder from the CDC, 2026. Children with autism may show an inability to communicate properly with others. This also includes adults. And an inability to communicate at all. This is another fact from About Autism Spectrum Disorder from the CDC. Once children start showing characteristics of autism, they may lose any and all milestones that they have developed up until that point. But let's move into the treatments available for autism spectrum disorder. Treatments for autism are very limited because there is no cure, but there are still some options to help manage it. This comes from Autism Spectrum Disorder from the National Institute of Mental Health. There are clinical trials that you can enroll your child in while they're young if they have severe autism to help manage it and learn more about it, obviously, because it is still very limited knowledge on it because it is such a diverse disease. This comes from Treatment and Intervention from Autism Spectrum Disorder from the CDC. Treatments are specified. Mainly has to deal with behavioral help, but you can have it for behavior, developmental, obviously, loss of milestones, educational, so help in school, learning disabilities, that's all included with autism, social relational, which has to deal with being able to go out and talk with people and communicate properly without breakdowns. Pharmacological and psychological tend to go one in one, so you have your therapy, obviously with medication given. I am medicated, have to be. Complementary and alternative care, so things that you could do at home to try and manage your feelings. This comes from Autism Spectrum Disorder from the Mayo Clinic, actually. Treatments are more leaning toward therapy, obviously, to help maintain the function and behaviors of the individual that is living with autism. But now that we know some treatments, let's take a look at the levels of support needed for those who suffer with autism and the families who they live with. Obviously, there are different levels of support necessary and available for those who suffer with ASD and their families who live around it every single day. This comes from Autism Spectrum Disorder from Autism Speaks 2026. Autism is broken down into 3 levels of support, or 3 levels of severity, actually. Level 1, which would be me, I am a level 1 patient. They're highly independent, able to operate mainly on their own with very little help. I do have a therapist who I see monthly, who actually helps me. So level 2 patients, actually they need a little more help. You sometimes can, sometimes cannot live on their own, depends. They do have issues with change and cope and just differences. But level 3 is obviously your highest tier. They are unable to live independently. They have to have constant help, 24/7 availability. These patients are unable to deal with any type of change or anything without significant breakdowns. I have 2 brothers that are actually that level, so it's a big thing. It's very hard to be around it sometimes. This comes from Autism Spectrum Disorders Related Support Groups in Kentucky, from Kentucky Faces, which is now our new name for like DCFS. But there tend to be local support groups, actually, that you can find in your area by Googling for parents who have children with autism to take their kids to, in order to get them set up with a therapist or somebody who can help them daily to manage and cope with what they're dealing with. This comes from Autism Research Review International from the Autism Research Institute. But you can actually find webinars and classes that will give you information. These are all usually free. You can take them at any time. Does not matter if you live or around it or anything else. If you want to learn more, you can always log into these webinars to learn how to cope and be around people who actually live with this disease. But, support is a necessity when dealing with such a complex disease. But now that we're closing up, today we have actually learned about autism spectrum disorder and the complexity of it. We learned about the characteristics, treatments, and levels of support included. And just to close out, with autism being such a massive and overly complex disease, it can be hard to look past the disease and see the person behind it. But we always need to remember that the person who lives with it is the one who is suffering the most, and they do deserve any bit of compassion and sympathy that they can be given. But thank you.